Hi everybody, congratulations. You have now completed Unit 2 of your First Aid Response phecc Certified Training course. In this unit we have looked at a number of things. We have looked at the general assessment and mechanism of the injury. What that really means is if you come across a scene, you want to establish, okay, what am I going to do here? First of all, you need to make sure that you are safe. If the scene is not safe, you don't enter. You would have considered things that would make a scene unsafe: debris, metal edges, electrocution, cold waters, glass, maybe having to approach a road that's very, very dangerous. So that's what you're looking at initially, is making sure that you're safe. After we've done that, okay, you need to find out, do I need an ambulance? How bad is this? Is somebody dead? If somebody has gone into cardiac arrest, should I do CPR? Should I make sure that the casualty doesn't move because I see a ladder and that is leading me to suspect a spinal injury? So you're looking at the general assessment of what's going on and mechanism of the injury. We need to figure out, do we need to call an ambulance here? Do I want help? We use the red card in order to give the correct details to the services that we're contacting. But bear in mind that they will ask you the questions too. Okay, so if you're not giving information on that request emergency dispatch card, you're going to be asked information from your casualty or from the paramedics or from whoever has picked up the phone to help you. Okay, so the beauty about first aid is it doesn't matter what has happened. For everybody that we want to help, we need to start the treatment with a primary survey. Initially, we do the initial assessment. The initial assessment, as I've just stated, is the primary survey. Once we've done the primary survey, we need to run through the components of then the secondary survey. So you have two surveys. So your instructor has already got you to look at the primary survey and the secondary survey and to practice what you might have to do in a primary and secondary survey. We start the primary survey, guys, with Dr. ABC. So it doesn't matter, asthma, choking, a car accident, heart attack, stroke. It doesn't matter what you've encountered. You need to make sure that there's no danger. Once we have established that there is no danger, we need to establish, okay, is this casualty dead or alive? Worst case scenario, they've gone into cardiac arrest. So in order to establish cardiac arrest, you need to check response. Hello, can you hear me? If the casualty is unresponsive, we are now worried about death. So what we need to then do is we need to make sure the casualty has an airway and to scan for breathing. So we scan for rise and fall of the chest. But obviously prior to doing that, we're making sure that we have maintained an opened airway by doing a head tilt and a chin lift. We scan for breathing 5 seconds, no more than 10 seconds. Once we have scanned for breathing and we've established that there is no breathing, then we are straight into CPR. We don't even go any further into our primary survey, and we're not even considering the secondary survey. We are actually just staying with Dr. ABC and we are doing CPR. There is one thing you do need to consider. If the casualty who's gone into a cardiac arrest, the casualty is not responding and not breathing or is only gasping, has gone into cardiac arrest, we need to make sure that there's no crazy bleed. If there's a crazy bleed, yes, we do need to stop that bleed before we go into CPR, which entails 30 compressions and 2 breaths for everybody. So catastrophic bleeding, we do need to stop a bleed. If we find a casualty who is not dead, so they're either responsive or not responsive and breathing, we then need to consider, should we move them? If the mechanism of the injury is making me feel that the impact of the trauma could have broke a bone in their back, we then need to consider spinal. So we're not going to move the casualty. And the best way to ensure that there is no movement is what is called the inline head stabilization, which would have been demonstrated prior in Unit 2 with your instructor. Okay, the inline head stabilization. Okay, once we have considered the inline head or spinal injury or the inline head stabilization, we then go on to monitor vital signs. The most important vital sign being the level of response. Is the person alert? If they're not alert, we're going to see if they're responding to your voice. If they're not responding to your voice, you're going to check and see if the casualty is responding to pain. And if the casualty is not alert, they're not responding to your voice, they're not responding to pain, that just simply means that your casualty is unresponsive, and now we need to make sure that they do have an airway and that they're breathing. If they're not breathing, it is CPR. Then we go on to monitor other vital signs such as pulse. The ideal pulse rate of an adult is 60 to 100. The ideal breathing rate then of an adult is 12 to 20. But bear in mind that the pulse rate and the breathing rate of a child can up to double. The ideal temperature for everybody, we look at skin. The ideal temperature for everybody is 37. If somebody's temperature is getting too hot, if they're getting too hot, their body temperature rises above 38. If they are getting dangerously hot, their body temperature rises to 40. If somebody is getting too cold, their body temperature drops below 35. And if they're getting dangerously cold, their body temperature drops to below 32. And if we are seeing like somebody who's getting dangerously cold, dangerously hot, we are actually worried about life-threatening shock. Okay, hypothermia, hyperthermia. Okay, so the skin can also, we're also monitoring skin as discussed for, you know, is it cold, is it clammy, you know, are the lips blue? The skin can give us a lot of information. Once we've done the primary survey, we go on to the secondary survey, which entails a very detailed head-to-toe examination to make sure you're not missing something, or, you know, there's no obvious signs or symptoms that could give you further information as to what's really going on with the casualty. So we do the head-to-toe examination, and thereafter we then look at sample interview. We want as much information from the casualty as possible. So we run through our sample interview, and that concludes, guys, Unit 2 of your first aid response, which has been run by Pro Training Courses today. I hope you're really enjoying the training, and we are now going on to, in our books, Unit 3, which is Incident Procedure. Okay, thank you and enjoy.